Okay, we're going to begin our second video lecture today on asepsis. And I want you to understand what that means, how that is sterile technique, and you're going to learn how to be opening up sterile packages, how to be laying a sterile field, how to be donning and doffing sterile gloves, and I'm going to go over all those skills with you today. So the first thing you need to understand is the difference between medical asepsis and surgical asepsis. So medical asepsis is really that clean technique, right? You're washing your hands, you are reducing the number of pathogens in your environment, you're cleaning your surface area, wearing gloves, doing hand hygiene. But surgical asepsis means sterile technique. It means an absence of pathogens. So when we are using something sterile or doing a sterile procedure, donning sterile gloves or whatever it may be that's sterile, that means there's no pathogens on that item, right? It is free from pathogens. It is considered sterile. And there's a little bit of a trick to doing sterile technique. And when you're first starting out, it's a little confusing. People get a little casual with it. They don't understand that there's no gray area. Something is either sterile or it's not sterile. And if you break sterility, it's an automatic, everything goes in the garbage and you have to start over. There's no window for mistakes here. There's no room for error. There's no kind of, well, I'm mostly sterile. That's kind of like being a little bit pregnant, right? It doesn't exist. So you're either sterile or you're not sterile at all. So when we talk about surgical asepsis, we're talking about having, again, we're free from pathogens. So think about surgical procedures, right? That is a sterile environment. Everything's sterile. If I am doing anything to a sterile body part, cavity, where I'm maybe inserting a Foley catheter, or I'm doing going into a wound or a sterile area of the body, I'm going to be using sterile technique. And so you need to understand how to go about, preparing for those procedures, what it means on the packaging. There's a lot of information to go over. So we're going to begin by understanding what the rules of or the basic principles of surgical asepsis are, okay? So only a sterile object can touch another sterile object. So if I set up a sterile field, I can only drop sterile items onto my sterile field. If I'm wearing sterile gloves, I can only touch something that is sterile, right? If somebody else is sterile, right, I can't go and touch them with my bare hands or give them something that is unsterile, right? They can't touch that. So sterile object can only touch another sterile object. When you're opening up packages, all of the sterile packaging are labeled. They're labeled that they're sterile. So the first thing you need to do is look at the packaging. Make sure it's not damaged in any way, shape, or form. If it is, throw it out. You also need to check the expiration date on all sterile packaging. It has to be up to date. And then you're going to see that you have certain openings, right, instructions on how to open sterile packaging. There's a reason for that. The reason is that we consider the border on things that we open up. There's what we call a 1-inch border on any packaging or anything inside our sterile fields and things like that. There's a 1-inch outer border that we consider not sterile. But when you're opening up sterile packaging, you're opening it up a certain way. And so you have to make sure that you see the arrows on your packaging. All sterile packaging has little flaps, right? That's where you're going to be getting started. That's where your arrow is. That's where your fingers are going to be opening up your sterile packaging. And all packaging is opened up away from you, right? You never want to open up sterile packaging towards you. It's always opened up away from you. All right, the other thing you want to do is avoid spilling anything on your sterile field or on anything that you have laid out that's sterile. If it gets wet, that's considered an automatic break in sterility, and everything has to be thrown away and you have to start over. All sterile objects need to be above your waist. What that means is that if I'm setting up a sterile field, right, I need to set it up above my waist. If I'm wearing sterile gloves, I need to hold my hands up above my waist. That's why you see in TV or whatever, in the movies or in real life, when people have sterile gloves on, they're holding their arms up and in front of them, because I need to, one, see my hands so I know I'm not accidentally contaminating my sterile hands, and I need to have them above my waist, because if they go below my waist, I may hit something accidentally and break sterility. So again, it's, your hands need to be above your waist, they need to be out in front of you, and you need to be conscientious of that sterile gloves that are on your hands, or any sterile field that you're laying down needs to be set up in front of you and at waist height. You need to not talk over your sterile field, cough over your sterile field, sneeze over your sterile field. You never turn your back on your sterile field because you'll have no idea if your jacket or anything may touch the sterile field. You never walk away from your sterile field. I never go, oh, I just set up my sterile field, but I forgot something, let me leave the room and go get it. Because when you leave the room, somebody might accidentally come in there and touch your sterile field and you'd never know about it. So you'd have to ask somebody else to go get you whatever it is that you think you might have forgotten. So never turn your back on it, never walk away. We know that we use, like I said, we use sterile technique if we're going into a sterile cavity in the body, putting something into a sterile cavity in the body, operating on a sterile cavity in the body. We're going to be using sterile technique. Sometimes we use what's called dry sterile forceps. So if you're doing something with wound care or whatever, a forceps is just an elongated clamp, and sometimes we use that to as an extension of our fingers. It's still a sterile instrument, but sometimes this way we don't accidentally touch the patient with our fingers. We may be cleaning the skin sterilely, or we may be, putting packing in something, and we may use a forceps so that we don't get our hands too close to the patient's body and break sterility. And then also, like I said, when we lay a sterile field or any sterile packaging that we open up, the outer 1-inch border is considered unsterile, okay? So we never place anything on that outer 1-inch border. And I'll show you that when I lay a sterile field or when we open up sterile gloves, okay? And then consider an object contaminated if you have any doubt. So what I always say is, when in doubt, throw it out. It is much cheaper to throw stuff in the garbage and start over than to run the risk of contaminating your patient and causing them to be septic and have all sorts of other problems. Just when in doubt, throw it out. If you think you made a mistake or you might have touched your nose or you're not sure, take everything off and start over again. The other thing that I really want to emphasize is that if you are assisting in a sterile procedure and you see somebody else break sterility, it is your responsibility to let them know they broke sterility. I don't care if it's the attending physician or your best friend. If somebody breaks sterility and you witness it, you must say something, because nobody should be proceeding if they've broken sterility on a patient, on a procedure on a patient, right? It just puts them at risk. There's no need for it. There's no ego involved. You just politely say, hey, I just saw you break sterility. Why don't I, call somebody to get you a new pair of gloves or a new gown or whatever it may be. So do not be afraid to, let people know if they've broken sterility. So sometimes you're going to be laying your own sterile fields down at the bedside because you might be doing a simple procedure. Maybe you're doing a wound care, dressing change on a patient, and you may need to have a sterile field because you're going to dump all your objects onto the sterile field and then do the patient's wound care at the bedside. Sometimes you're doing a huge sterile field. You're working in the operating room, right? And all those trays are being opened up and you're putting all these huge sterile drapes everywhere. So depending on where you're working will depend on, how big or how small your sterile field weight might be. A lot of times if you work in critical care, you're assisting with certain sterile procedures at the bedside. And so you're might even be laying a big sterile drape over the patient themselves. So again, lots of different procedures to be done, but let's just say we're doing a dressing change at the bedside. We're going to lay a little sterile field on our overbed table. You want to make sure your overbed table is clean and dry, 100% dry. You don't want your sterile field getting wet. You're going to look at your packaging, make sure it's intact, check your expiration date, make sure it's not expired. Then you're going to find your little arrow on your packaging that's going to tell you what side you're opening it up from. And then you're going to see these little flaps here. These are the flaps that I'm going to open up. When I open up my sterile drape, I need to be very careful not to, open it up too fast. I don't want to rip the paper and accidentally touch the sterile drape or have it fall out. So I'm going to open it up very carefully, and I'm going to get the paper opened, and I'm going to open it up, and I want to open it up so I see the edge of my sterile drape. Now, when I open up the sterile drape, I am allowed to touch the outer corner. Remember, the outer 1-inch border is considered unsterile. So I'm going to be picking up the sterile drape with my regular clean hand. I'm going to grab the corner of the sterile drape, and when I grab that corner and I lift it up, you're going to see that sterile drape is going to fan fold open. I'm going to take my packaging, right, and drop it into my garbage can below me, and then I want to grab the corners of my sterile drape because these are, again, my 1-inch outer border. I keep it up, away, and in front of me, so that I'm not touching the overbed table. And these drapes are a little sticky, so sometimes you have to either try and shake them open if you can. If you can't, then you've got to walk your fingers around that 1-inch border to try and open it up. Now you'll notice that these sterile drapes, some of them have a blue front and a white back. The white back is what's going to lay on my overbed table, and the blue is going to be the face up side that I'm going to be laying my sterile equipment on. Sometimes there's a shiny side and a dull side. It just depends on the product that you get. But as you can see, I'm just holding the outer 1-inch border. I'm keeping it up and away from my table, and I'm keeping it away from myself. Now I want to lay my sterile field onto my overbed table without contaminating the blue side, which is going to be my sterile side to lay my sterile drapes. So I'm going to come around to the side, and I'm going to go ahead and lay my drape on the overbed table. Okay? I'm going to avoid, again, leaning over my sterile drape. I'm going to avoid coughing or sneezing on it. If I need to move the table, I can move the table from the underside. I don't have to touch the sterile field on the top. And then I'm going to go ahead and let's say I want to drop some items onto my sterile field because I'm going to be doing a dressing change. I'm going to need some equipment. So let's say I want to drop some 2x2s or maybe a sterile pair of scissors. I'm going to be dropping everything onto my sterile field before I do any part of the procedure. So if I'm dropping onto a sterile field, there's a couple of rules that you need to remember. You always drop onto your sterile field directly in the center. You drop from 6 inches above the sterile field. You want to avoid that 1-inch outer border because that is considered not sterile. Whatever you're dropping onto your sterile field must be sterile. Remember, sterile touches sterile. So I have to look at my packaging and make sure it's intact. Make sure there's no expiration date, that my packaging is not expired. I look for my little arrows to see where I have to open it up. If there's no arrows, then you're just looking for those flaps, and you want to find your flaps. And it's very important when you're dropping your items onto a sterile field, I'm going to be opening up my packaging and I'm going to be dropping it away from me, okay? It's kind of awkward. So my forearms are starting to face the ceiling and my hands are going to open up this packaging very slowly and carefully. I'm going to peel it back without touching anything further than that border. And then I'm going to pour it away from me 6 inches above the sterile field directly into the center, okay? And then the packaging itself will go in the garbage. If I want to drop my sterile instrument, it's going to be the same thing. I'm going to make sure my packaging is intact, it's not expired. I'm going to open it up where the flaps are. I want to open it up away from me, and I want to drop my sterile instrument 6 inches above my sterile field right into the center of my sterile field, okay? And you would continue to keep dropping everything you need onto your sterile field, and when you're 100% done with all your sterile supplies on your sterile field, then it's going to be time to work with the patient. Now, remember, in order for me to pick up any of these sterile instruments or sterile 2x2s or dressing change information, I must put on sterile gloves. And in order to put on sterile gloves, right, I have to have space. So I don't have enough space where my sterile field is to open up my sterile gloves. I would totally contaminate it, right? So I'm gonna go ahead and just move this off to the side, but keeping it right in front of me, not walking away from it. I'm gonna get another overbed table, putting it above my waist, and then I'm going to be getting ready to put on my sterile gloves. One thing you need to do when you're putting on sterile gloves is to not have anything dangling. No bracelets, no big thick watches. Even rings can break your sterile gloves, so you need to be really careful when putting on your sterile gloves. You want to make sure that you kind of take anything off that's going to be loose or get in the way. So in my case, the lab coat sleeves are too loose, my watch is too big, so I want to get all that stuff off. How do I know what size sterile gloves to go and get, right? You're going to see sterile gloves anywhere from size 6 to a size 9. Well, you guys are going to have these little cards in class. You're going to be able to put your hand on the card, and where the back of your pinky lays is going to tell you what size glove you should get. It's not 100% accurate, but it's pretty close. And so when you figure out what your size is and you go to try on your sterile gloves with your clinical instructor and you're starting to put them on, if they're too tight, you really can't get them on at all, or too loose, then you either want to go up a half a size or down a half a size. And they do have half sizes, so it's 6, 6.5, 7, 7.5, 8, 8.5, and 9. The most common size I would say is probably about 7.5, but again, everybody's different. So you need to measure your hand, determine what your size is, and then you're gonna have sterile gloves on a cart. They're gonna go from room to room, so everybody's gonna measure their hands, get their sterile gloves that are their size, and then you're gonna start learning how to don your sterile gloves. So all I wanna do quickly is just kind of flash forward on the PowerPoint, just so you can see laying the sterile field like we just talked about, placing items onto the sterile field like I just did, right, 6 inches above the center, pointing the packaging away from you. If you do have to use a liquid on a sterile field, which sometimes happens, you just have to be very careful that you don't splash or spill the liquid onto your sterile field. It usually goes into a sterile basin, and you're usually pouring it from about a height of 4 to 6 inches. You just want to make sure there's no splash. And again, if that happens and you splash and wet your sterile field, everything in the garbage and you have to start over. Preparing a sterile kit or tray, you guys are going to be doing this when you get into Med-Surg and into OB. You're going to be opening up those kits that are in your bag. Those are your wound care kit, your Foley catheter kit, and also, like I said, for pediatrics, that sterile suction kit. So those kits you're not going to be using in fundamentals. You need to keep them sealed and closed and sterile, but you will be using them down the road in Med-Surg, Peds, and OB. And again, opening up those packages there's a process to it. And so you want to open up the outer packaging, making sure that it's intact, that it's not expired. When you open up a sterile kit, you're going to see that it's already wrapped in its own sterile field. And it's wrapped like a diamond. And so you have to open it up like a diamond. You open up the first flap away from you. Then you open up the 2 side flaps. And then the last flap you're opening up towards you. So you're taking a step back when you open up that last flap. So you can see through the slides, you know, how it was opening up. She opened it up the first flap away from her, then side to side, the last one towards her while taking a step back. Now that's opening up in a diamond pattern on your overbed table. And remember, you're allowed to touch that 1-inch outer border, so you can straighten that diamond and just do a half turn into a square, and you'll have it nice and even on your overbed table. And that's how you'll open up a sterile packaging. But again, that's something you're going to be doing down the road. As far as sterile gloving is concerned, that you will be doing in class. You'll be opening up, you do have sterile fields in your kits, so you'll be opening up a sterile field, you'll be dropping stuff onto a sterile field, and then you'll be donning sterile gloves as part of your skills for the day. So in order to don the sterile gloves, you need to, again, check your packaging, make sure that it is not expired, that you have the right glove size, that it's intact, that there's no holes or anything. When you open up the outer packaging for the sterile gloves, you're just opening it up and you're taking the paper packaging out. The packaging on the outside, you can touch this, it's not sterile, or it is sterile, but it's not going to remain sterile because you need to touch it in order to open up the packaging. When you open up the packaging for sterile gloves, you're going to notice that it's folded up like a book. On the outside is going to be the size of the glove, and then when you open the book, you're going to see, it's going to tell you what hand, left and right. You're also going to see the way it's folded. That 1-inch border is going to be part of the fold of the gloves. So when I lay down my gloves, I'm going to lay them down like a book. I'm going to open it up so that I have it open. And then what I want to do is I want to take that 1-inch border and I want to open up the 1-inch border. Now these glove packaging are really tight, and the paper always wants to fold back on itself, and there's a few tricks to getting the paper to stay open so it doesn't keep folding back on itself and you don't get frustrated and accidentally touch the sterile part that you're not supposed to touch. So the first thing you want to do is take the first fold, and I open it up, and I actually open it up and I just fold it back a little bit to break that crease. Then I take the bottom fold and I do the same thing. I fold it open and then I fold it back a little bit to break the crease. And now what you're going to be left with is a flap that's running down the center on the right and left side. That flap, you need to get your fingers underneath it, okay? So I'm going to take my fingers and I'm going underneath that flap. That flap is part of your 1-inch border. And again, Sometimes the packaging sticks a little bit, but you need to go underneath the flap. So you're just gonna have to run your fingers under it until you loosen it all up. And some of them are open up a little bit better. Once you get that flap loosened, now you're going to take the outer edges of the flap, which is your 1-inch border, and you're gonna open it up. Now, if I were to just open this up and let it go, what happens? It folds right back on itself, because these seams in the glove packaging have been closed for a long time. So I need to break the seam a little bit without touching anything sterile and without breaking the paper. So what I do is I take my flap and I just pull it really tight until my gloves kind of just raise up a tiny touch. So I pull that paper tight. Once I pull it that tight like that, I kind of break the seam, and then my glove packaging will usually lay flat and it will not fold back up on itself. And then we're gonna do something a little bit silly to help you remember how to put your sterile gloves on, okay? So if you guys have ever watched the movie Legally Blonde, you might remember the bend and snap, right? So I like to call this the pinch and scoop. So the first thing you're gonna do is take your clean hand, right? And you're going to be, I'm a righty, so I'm gonna be pinching with my left hand and putting the glove onto my dominant hand. The place that you're gonna pinch is the cuff of the first glove. Now the gloves are packaged, they're laying down, right and left, they're labeled, but the cuffs of the glove are inside out. And the first glove, cuff that's inside out, you are allowed to pick that up and pinch it, because when you put that glove on, the part that you're actually pinching is gonna be rolling back onto your skin, and so it's gonna get contaminated anyway. So the first thing you're gonna do is pinch the cuff. Where on the cuff? Closest to where you're gonna put your hand in. Not closest to where it's sterile, but closest to your body, closest to where your hand is gonna go in. So I'm gonna go ahead and pick up the cuff of my glove using the pinch. I'm gonna pick it up and away from me. So as you can see, I'm just pinching the folded cuff. Now I'm gonna take my dominant hand and I'm gonna just put the glove on. I'm gonna be very careful to keep it away and in front of me. And once I get that glove on, my hand's in it, I have a little bit of cuff here left over that I can roll down. Be careful rolling down the cuff. You don't wanna roll it down so much that your pinching fingers accidentally touch the sterile part of the glove. So you can roll it down a little bit, but don't go crazy, because you might accidentally touch the sterile part and contaminate your glove. So that's the pinch part. The next part is the scoop part. And now, because I'm sterile, I can only touch sterile. So I'm gonna be scooping now, instead of the outside of the cuff, I'm gonna be scooping the inside of the cuff, the part of the cuff that's resting on the sterile part of the glove. And I can do that because now I'm sterile to sterile. So I'm coming in for the scoop, I'm going under the cuff. What happens here a lot of times is that the paper is starting to move and it's starting to get away from you, and you're starting to get all kind of, nervous because the paper's moving. You want to put some downward pressure on the paper and on the glove. Get your fingers underneath that cuff, and once your fingers are inside the cuff, then you're going to come up and away from you. Now, I need to get my hand into this glove, and I have to be careful because my sterile thumb is still hanging out here. But all my fingers are protected because they are inside the cuff. So what you want to do is move the thumb away like you're hitchhiking, and now you're going to go ahead and get your glove, your non-sterile hand into the glove. While you're getting into the glove, your fingers are inside the cuff. You're not touching anything but the inside of the cuff, and you're getting that glove in. Once your hand is in, you can release the inside of the cuff, and now you have both your hands in sterile gloves. All right. So you're going to keep your hands up and away from you, above your waist, and in front of you when you are now sterile. One mistake students make once they get these sterile gloves on is they immediately want to go ahead and throw away their packaging, their garbage, and they scoop right underneath it and break sterility, throwing away the garbage. Leave it alone. Once you're done with the packaging, you can throw away the garbage at the end of your sterile procedure. You don't have to worry about it, okay? And now that I have my sterile gloves on, I can go over to my sterile field, and now I can start touching anything in my sterile field because I am now sterile to sterile, okay? So remember, when you're putting on sterile gloves, you want to do the pinch and the scoop. You will practice this skill with your clinical instructors. Once you're done doing your sterile procedure, you can take off the gloves by just kind of loosening up the fingertips. And then you're going to go ahead and if you want to recycle the gloves because you want to continue to practice in them, we will give you 2 pairs of gloves, and you can save them and you can repackage them and you can continue to practice doing sterile technique, which is what I would recommend. So you don't have to like take them off and turn them inside out like you would a pair of used gloves and throw them in the garbage. You can just pull them by the fingers, slide them off, recuff them, and relay them into your sterile packaging, and you can kind of repurpose them and reuse them again and practice this procedure at home. You know, there are students going through some sterile training, sterile technique testing right now, and again, they're making silly mistakes. They're touching things with their sterile gloves. They're not doing the pinch and scoop correctly, and so they're failing sterile technique on basic, simple things. So you really need to focus. There is no middle ground. There's no gray area. It's either sterile or it's not. And if you've broken sterility, boom, it's a failure, everything in the garbage, start over again, all right? So don't let me see anybody, you know, complaining like, oh, I was almost, you know, I almost got it right. There's no almost. So you're gonna go through the slides on the pinch and scoop. You're going to practice this skill with your clinical instructor. You're gonna open up a sterile field. You're gonna lay stuff on the sterile field, size yourself for sterile gloves, and practice doing the sterile gloving, all right? I think you guys are gonna do great. I'm sorry I couldn't be here with you this week. Remember to, if you have extra time today too, and you want to do a little med-admin practice for validation, that's great. I will definitely be back for our last week, which is med validation, and also for hospital day and everything like that. So feel free to come to Open Lab. On Monday, Professor Gentles is going to be covering Open Lab, and on Thursday, or today actually, right, is your class. So I'm kind of talking in the past here about Monday. Today after class, if you do need some time in Open Lab, I think Professor Lynch said she would be willing to stay, but you might have some extra time at the end of the day to get some of this stuff done. Alrighty, so I wish you all the best, and I will see you next week. All right, take care.